Dear students, welcome back. In the previous session, we have discussed about the osteokinematics part 1, that is a motion of the femur at the hip joint. Now, in this session, we are going to discuss about motion of the pelvis at the hip joint. Okay, when the proximal segment of a joint, here, normally in the hip joint, pelvis becomes the proximal segment and femur becomes the distal segment. Okay, when the proximal segment of a joint moves on a fixed distal segment, the motion across the joint is the same as if the distal segment were moving part. That means whatever may be the segments will move. So whether it may be a pelvis or femur, the range of motions will not be changed. Okay. However, the direction of movement of the liver reverses. Okay. For example, in the case of elbow flexion, in the elbow flexion, a rotation of the distal forearm upward or a rotation of the proximal humerus downwards can be seen. Okay, at the hip joint, this reversal of motion of the liver is further complicated by the horizontal orientation and non-lever shape of the pelvis and by the new set of terms that refer to pelvic motions. Okay, so in the case of elbow joint, the liver is almost in a straight line or in an angular form, isn't it? So this can be having a vertical orientation here, but in the case of pelvis, it is having an horizontal orientation, and also the liver shape is also not that much seen in the upper limb levers. It is having a non-lever shape of the pelvis and the femoris can be seen here. Okay, the pelvic motions are named because these are the motions that are seen by the observer. So here the terms are changing. So when we see the motion of the femur, we have given flexion, extension, abduction, adduction because the movement of the femur at the hip joint which we are visualizing. For that reason the names are given. Here why the terms are given in the pelvis differently means here we are observing the movements of the pelvis on a fixed femur. Okay, for that reason we are seeing the movements which are taking place in the pelvis. So the terms are given to the pelvis here. Okay, so now what are the movements taking place by the pelvis at the hip joint is, one is the pelvic tilts. Okay, this may be anterior and another one is rotation. Pelvic tilt and rotations are taking place by the pelvis at the hip joint. So if you see the tilts, pelvic tilts, it is of two types. One is anterior and posterior pelvic tilt and the next one is the lateral pelvic tilt. So now first we will discuss about the anterior and posterior pelvic tilt. So here these pics are related to anterior and posterior pelvic tilt. So this one is the pelvis and femur in normal position in erect stance. Okay, now so this anterior and posterior pelvic tilt are motions observed in the sagittal plane around a coronal axis. In the normally aligned pelvis, the anterior superior iliac spines of the pelvis lie on horizontal line with the posterior superior iliac spines. Okay, so this is the horizontal line. If you can see the anterior superior iliac spine to the posterior iliac spine, this both are appeared in horizontal way. Okay, and vertical line with anterior superior iliac spine with that of the pubic symphysis. Okay, so this is the orientation of pelvis, that to normal pelvis when the person is in erect stance. This is the position of pelvis. Okay, in the horizontal way, the anterior superior iliac spine and the posterior superior iliac spine are in horizontal, whereas this vertical line which is almost straight, which is touching the anterior superior iliac spine to the pubic symphysis. Okay, this is the normal position. So then what happened during posterior tilting and anterior tilting of the pelvis? For what is the orientation here? Okay, the posterior and anterior tilting of the pelvis on a fixed femur produce hip extension and flexion respectively. So this posterior tilting causes hip extension. So what is happening in the posterior tilting of the pelvis? So here if you see, the distal segment is fixed, the femur is fixed, and now the pelvis is rotating posteriorly. So this is the posterior rotation of the pelvis here. So then what happens? This pubic symphysis comes upward. So in this orientation, which causes the hip extension. So the posterior tilting causes hip extension. So if you see in the case of normal movement of this femur, then also if the femur is moving like this, then this is the orientation observed when the pelvis also fixed. So for that reason, the posterior tilting of the pelvis causes hip extension. Okay, if you see the orientation of this horizontal and vertical lines also, so now this is not in vertical line, so it making some angulation, yes, with the normal vertical horizontal line it is making something, and the vertical line is also become slant in posterior tilting. That means it goes backwards, the line will go backwards. So with all these things we can say that here the posterior tilting of the pelvis occurs. And next, so in the anterior tilting the same thing happened, that is what is happening here? Hip flexion is taking place. Okay, because the pelvis is tilting anteriorly, and this causes hip flexion. Okay, so what happens here means the hip joint extension via posterior tilting of the pelvis brings the pubic symphysis up and the posterior aspect of the pelvis closer to the femur. Okay, rather than moving the femur posteriorly on the pelvis. Next, hip flexion through anterior tilting of the pelvis brings the anterior superior iliac spines anteriorly and inferiorly. So these thing will come anteriorly as well as inferiorly. Okay, rather than the femur is moving towards the pubic symphysis. Okay, the anterior and posterior tilting can occur around both hip joints simultaneously and can occur in single limb support around one hip joint axis also. Okay. So if you again see this tilts, the posterior tilting of the pelvis moves the pubic symphysis superiorly on a fixed femur, which shows the posterior tilting. The hip joint extends here. And in the case of anterior tilting, the anterior superior iliac spines move inferiorly and downwards on the fixed femur. Then the hip joint flexes. So this is about the anterior and posterior pelvic tilt. Now we will see the lateral pelvic tilt. Yes. So the lateral pelvic tilt occurs in the frontal plane motion around an AP axis. In the normal aligned pelvis, a line passes through the iliac crest in horizontal. So normally this already in tilting position. So normally this iliac crest are in horizontal position. The line what we are seeing here, which is in horizontal in position during a normal stance. Okay, in lateral tilt of the pelvis, one hip joint serves as the pivot joint or axis, and the opposite iliac crest elevates. Elevates means here hiking, or drops, or it is called as pelvic drop around that pivot joint. Okay, so for example, here we are taking the left hip joint as an axis. We will call it as support. Okay, so this joint, left hip joint, serves as a pivot joint or axis, and the opposite iliac crest. So here, which one is the opposite iliac crest? On the right side. So if it is elevates means which causes hip hiking. So the same joint acts as still the pivot joint. So if the opposite iliac crest drops, then it is called as pelvic drop. So if the opposite side of the iliac crest of left side causes a right hip hiking, and the opposite side of the left hip iliac crest drops, then it is called as a right pelvic drop. So this is called as lateral tilting. The tilting may be hiking or dropping, both comes under lateral pelvic tilt only. Okay, so what happens? So if the tilting is taking place, we have seen that anterior tilting of the pelvis causes hip flexion, posterior tilting causes extension, isn't it? Now what is happening during hip hiking and pelvic drop at the hip joint, at the left hip joint? So if you are seeing this, so normal hip joint, normal pelvis and hip joint, just assume it. Okay, now so the other part of the pelvis is hiking. That means, so there is a tilting of the pelvis taking place towards the right side and upward. That means there is a movement towards the upward side. So that means the normal pelvis, which is present like this, which will move like this. So that means it is moving away from the hip joint. That means it causes abduction here. So you can find the abduction. If you see the tilting downwards, then it is called as pelvic drop, so which causes the pelvis moves towards the joint, which causes adduction. So during lateral pelvic tilt, the hiking of the pelvis around the left hip joint, causes in the left hip abduction, and dropping of the pelvis around the left hip joint results in the left hip joint adduction. Okay, so this is about lateral pelvic tilt. Okay, next we will move on to the pelvic rotation. So what is happening in the pelvic rotation? So pelvic rotation occurs in the transverse plane around a vertical axis. So this pelvic motion occurs in the transverse plane around a vertical axis. Although rotation can occur around a vertical axis through the middle of the pelvis, it most commonly occurs in single limb support. So this pelvic rotation normally occurs during single limb support around the axis of the supporting hip joint. Okay, so normally it occurs in a single limb support. So for example, here the right hip is in axis and axis, and also the right leg is the single leg support. So now this hip joint, what is that? A right side hip joint acts as an axis here. On this point, the pelvis is going to rotate now. So here if you can see on the B picture, this is the neutral position of the pelvis and the right hip joint. Okay. So this can be defined like this. Forward rotation of the pelvis occurs when the side of the pelvis opposite to the supporting hip joint moves anteriorly. So that means the forward rotation of the pelvic rotation can be defined as when the side of the pelvis opposite to the supporting hip joint moves forward, okay, or moves anteriorly, then it is called as left forward rotation. Okay, so this motion causes medial rotation at the right hip joint. It causes medial rotation to the right hip joint. Okay. So as in the lateral pelvic tilt, the reference for the pelvis is always the side farthest from the supporting limb. If the side of limb support is known, then we can find easily which side of the pelvis is rotating forwardly or backwardly. Okay, the medial rotation of the hip joint that occurs during forward rotation of the pelvis can be best appreciated by doing the motion by yourselves, like standing on one leg and rotating the pelvis and trunk forward as much as you can. Will give you the feeling of the relative medial rotation of the supporting limb. We see the backward rotation of the pelvis occurs when the side of the pelvis opposite to the supporting hip moves posteriorly, which causes posterior pelvic rotation. So this type of posterior rotation of the pelvis produces lateral rotation of the supporting hip joint. This also can be best appreciated by doing the same motion, but you have to rotate your pelvis backwards. Then you can feel the medial rotation and lateral rotation at the supporting hip joint. Okay, so these are all the motions of the pelvis at the hip joint. In the next session, we are going to discuss about coordinated motions of the femur, pelvis and lumbar spine. Simply we can call it as lumbar pelvic rhythm. Thank you.